Hello student, today I am going to talk on the topic of Mass Public Social Welfare Program for Disabled. Introduction. Disability is a part of the human condition. Almost everyone will be temporarily or permanently impaired at some point in life, and those who survive to old age will experience increasing difficulty in functioning. Most extended families have disabled members, and many non-disabled people take responsible for supporting and caring for their relatives and friends with disability. Every effort have faced a moral and political issue on how best to include and support people with disabilities. This issue will become more acute as the demographic of society changes and more people live to an old age. Response to disability have changed since 1970, prompted largely by the self-organization of people with disability and by growing tendency to see disability as a human rights issue. Disability is complex, dynamic, multi-dimensional and contested. Over recent decades, the disability people movement, together with numerous research for the social and health science, have identified the role of social and physical barrier in disability. The transition from an individual medical perspective to a structural social perspective has been described as the shift from a medical model to a social model in which people are viewed as being disabled by society rather than by the bodies. The medical model and the social model are often presented as dichotomous, but disability should be viewed neither as purely medical nor as purely social. Persons with disability can often experience problems arising from the health condition. A balanced approach is needed, given appropriate weight to the different aspects of disability. A person's environment has a huge impact on the experience and extent of disability. Inaccessible environment create disability by creating barrier to participation and inclusion. Example of possible negative impact of the environment includes: number 1, a deaf individual without a sign language interpreter. Number 2, a wheelchair user in a building without an accessible bathroom or elevator. Number 3, a blind person using a computer without screen reading software. Health is also affected by environmental factors such as safe water and sanitation, nutrition, poverty, working condition, climate, or access to healthcare. As the World Health Organization, that is WHO, Commission on Social Determinants on Health has urged, inequality is a major cause of poor health and hence of disability. The environment may be changed to improve health condition, prevent impairment, and improve outcome for persons with disability. Such change can be brought about by legislation, policy change, capacity building, or technology development, leading to, for instance, accessible design of the built environment and transport. Next, signage to benefit people with sensory impairment. Next, most accessible health, rehabilitation, education, and support services. Next, more opportunities for work and employment for persons with disability. Environmental factors include a wider set of issues than simply physical and information access. Policies and service delivery system include the rules underlying service provision can also be obstacle. New emphasis on environmental factors. The International Classification of Functioning, Disability and Health, that is ICF, advanced the understanding and measurement of disability. It was developed through a long process involving academicians, clinicians, and importantly with persons with disability. The ICF, International Classification of Functioning Disability and Health, emphasize environmental factor in creating disability, which is the main difference between this new classification and the previous international classification of impairment. Disabilities and handicap, that is ICIDH, in the ICF, that is International Classification of Functioning Disability and Health, problem with human functioning are categorized in three interconnected areas. Number 1, impairment or problem in body function or alteration in body structure. For example, paralysis or blindness. Number 2, activity limitation or difficulties in executing activities. For example, walking or eating. Number 3, that is participation restriction or problem with involvement in any area of life. For example, facing discrimination in employment or transportation. A public health approach distinguishes primary prevention, action to avoid or remove the cause of health problem in an individual or a population before it arises. It includes health promotion and specific protection, that is, for example, HIV education. Secondary prevention, action to defeat a health problem at an early stage in an individual or a population, facilitating cure or reducing or preventing spread or reducing or preventing its long-term effect. For example, supporting women with intellectual disability to assist breast cancer screening. Tertiary prevention, action to reduce the impact of an already established disease by restoring function and reducing disease-related complications. For example, rehabilitation for children with musculoskeletal impairment. Disability and human rights. People with disabilities experience inequality, for example, when they are denied equal access to healthcare, employment, education, or political participation because of their disability. People with disabilities are subject to violation of dignity, for example, when they are subjected to violence, abuse, prejudice, or disrespect because of their disability. People with disability are denied autonomy, for example, when they are subjected to involuntary sterilization or when they are confined in institutional against their will, or when they are confined in institution against their will, or when they are regarded as legally incompetent because of their disability. Next point, that is social welfare program for disabled. The grant of the rights and privilege for disability person shall be guided by the following principles. Number A, disabled persons are part of the society, thus Legislative Assembly shall give full support to the improvement of the total well-being of disabled person and the integrity into the mainstream of society. Towards this end, the state shall adopt policy ensuring the rehabilitation, self-development, and self-reliance of disabled person. It shall develop their skill and potential to enable them to compete favorable for available opportunities. Number B, disabled persons have the same rights as other people to take their proper place in society. They should be able to live freely and as independently as possible. This must be the concern of everyone, the family, community, and all government and non-government organizations. Disabled person rights must never be perceived as welfare service by the government. Number C, the rehabilitation of the disabled person shall be the concern of the government in order to foster the capability to attain a more meaningful, productive and satisfying life. To reach out to a greater number of disabled persons, the rehabilitation service and the benefit shall be expanded beyond the traditional urban-based center to community-based program that will ensure full participation of different sectors as supported by national and local government agencies. Number D. The state also recognizes the role of the private sector in promoting the welfare of disabled persons and shall encourage partnership in programs that address their needs and concerns. Number E. To facilitate integration of disabled persons into mainstream of society, the state shall advocate for and encourage respect for disabled persons. The state shall exert effort to remove all social, cultural, economic, environmental, and attitudinal barriers that are prejudicial to disabled persons. Next point, that is definition of term for purpose of this act. These terms are defined as follow. Number A. Disabled persons are those suffering from restriction of different abilities as a result of a mental, physical or sensory impairment to perform an activity in a manner or within the range considered normal for a human being. Number B. Impairment is any loss, diminution or absorption of psychological, physiological or anatomical structure of function. Number C. Disability shall means number 1. A physical or mental impairment that substantially limit one or more psychological, physiological or anatomical function of an individual or activity of such individual. Number 2. A record of such impairment. Number 3. Being regarded as having such impairment. Number D. Handicap refer to a disadvantage for a given individual resulting from an impairment or a disability that limits or prevents the functions or activity that is considered normal given the age and the sex of the individual. Number E. Rehabilitation is an integrated approach to physical, social, cultural, spiritual, educational, and vocational measures that create conditions for the individual to attain the highest possible level of functional abilities. Number F. Social barrier refer to the characteristic of institution, whether legal, economic, cultural, recreational, or other, any human group, community, or society, which limit the fullness possible participation of disabled person in the life of the group. Social barriers include a negative attitude which tend to single out and exclude disabled person and which default roles and interpersonal relationship. Number G. Auxiliary aids and service include number 1. Qualified interpreter or other effective method of delivering material to individual with hearing impairment. Number 2. Qualified reader, tape test, or other effective method of delivering materials to individual with visual impairment. Number 3. Acquisition or modification of equipment or device. And number 4. Other similar service and actions or all types of aids and service that facilitate the learning process of people with mental disability. Next, that is number H. Reasonable accommodation include number 1. Improvement of existing facilities used by employees in order to render this readily accessible to and usable by disabled person. Number 2. Modification of work schedule, reassessment to a vacant position, acquisition or modification of equipment or device, appropriate adjustment or modification of examination, training material, or company policy, rules and regulation, the provision of auxiliary aids and service, and other similar accommodation for disabled person. Next, that is number I, shelter employment refer to the provision of productive work for disabled person through workshop providing special facilities, income producing project or homework schemes with a view to give them the opportunity to earn a living, thus enable them to acquire a working capability required in an open industry. Conclusion: disability is a development issue because of its directional link to the poverty. Disability may increase the risk of poverty, and poverty may increase the risk of disability. A growing body of empirical evidence from across the world indicate that people with disabilities and their families are more likely to experience economical and social disadvantage for those without disability. The onset of disability may lead to the worsening of social and economic well-being and poverty through a multitude of channels, including the adverse impact on education, employment, earning, and increased expenditure related to disability.